Minister of Health Dr. Frank Anthony approximately 2 weeks ago had indicated that 20,000 antigen test kits are being procured for the hinterland regions. The antigen tests are conducted outside of a laboratory setting. The test kits, according to the minister, are expected to arrive in Guyana within the next 2 weeks. The minister disclosed that the kits are being acquired through the Pan American Health Organization, World Health Organization. However, the effectiveness of the antigen tests is still being debated. The United States Food and Drug Administration, after issuing emergency use authorization for the first antigen test, where results can be read directly from the testing card in May 2020, warned of potential false positive results with the rapid detection of COVID-19. Via a letter on November 6, the FDA alerted clinical laboratory staff and healthcare providers that false positive results can occur with antigen tests, including when users do not follow the instructions for use. Meanwhile, the Pan American Health Organization in October said the new reliable antigen diagnostic tests, which were approved by the World Health Organization, promises accurate results even in remote communities. Concerns in relation to the efficacy of the antigen test kits were posed to Health Minister Dr. Frank Anthony by this newscast during a recent exclusive interview. The minister, while acknowledging the questionable results the test kits are likely to produce, explained that a polymerase chain reaction PCR test will also be conducted in some instances to ensure accuracy of results.
Using the antigen tests, we'll be able to get back a result within 15 to 20 minutes. Now, in some cases, if the doctors still have a doubt, then we can then do the PCR test. But I think as a screening tool, it would help us to be able to meet more people and to make a diagnosis faster. So if we see like somebody with all the typical clinical signs of COVID, rather than waiting on a PCR, we can do the antigen test, and if they come back positive and it matches and we see all the signs and symptoms, then we know more than likely it's COVID.
The PCR test has been approved globally as the most efficient testing methodology to detect strains of the coronavirus. Samples are collected countrywide and tested at a national reference laboratory. Dr. Anthony informed that the ministry is streamlining a list of protocols which will guide clinicians on how the tests ought to be carried out and what constitutes a proper PCR test. Antigen tests are currently authorized to be performed on nasal swab specimens placed directly into the assay's extraction buffer or reagent. Timeka Rodney reporting for the HGP Nightly News.